delivering fetus that comes out. And you hope that it's the head, because that's the easiest, and you really hope it's not the bottom with the legs folded up, because that's very difficult. While most pregnancies go just fine, there are a number of things that can complicate a pregnancy, and we'll talk about each of these. In a miscarriage, a fetus is delivered before it's able to survive outside of the uterus. The major issue for you is that if there's any parts that are retained, particularly the placenta, the patient can have uncontrolled hemorrhage, and the treatment for that is to contact medical control, start an IV to give IV fluids, and evacuate the patient. If it's a simple, uncomplicated miscarriage, you don't necessarily have to evacuate the patient. A pregnant patient can also suffer from what's called eclampsia, which is a pregnancy-related seizure. We don't actually know for sure why these happen, but they're life-threatening to both the mother and the fetus. Your treatment here is airway breathing and circulation control and contact medical control. The only medication you're going to have that you'll be able to give is diazepam, an anti-seizure medication, and you need to evacuate the patient if that's the case, that they're having an eclamptic seizure during pregnancy. Premature delivery is sort of the flip side of a miscarriage. The fetus is beyond 23 weeks, and so it's theoretically able to survive outside of the uterus, but it's delivered before it completely develops. And this is a real problem. The delivery will be very easy. These are very small fetuses, but if it's under 30 weeks, unless you happen to have a neonatal intensive...
It will be overwhelming. An expectant mother is inundated with information and advice from every direction. She can become stressed, confused, or conflicted. How does an expectant mother prepare? How does she know where to look or what to do? That's where you come in. Childbirth educators clear the noise, providing a mom-to-be with the evidence-based knowledge and tools for a safe and healthy birth. Leading up to birth, a childbirth educator prepares the expectant moms, dads, and families with information and options. Lamaze childbirth educators utilize a wealth of research and evidence to guide families through their pregnancy and birth journeys. As a recognized name with a rich history based on evidence, Lamaze International promotes a natural, safe, and healthy approach to pregnancy, to childbirth, and to the early days as a new parent. Today's modern moms have so much information at their fingertips. Lamaze clearly translates research and evidence that can be easily understood for a healthy birth. Lamaze is built on these 6 healthy birth practices for good outcomes. This strong foundation is what continues to make the organization a leader in childbirth education. As a member of Lamaze, you will be joining respected, skilled childbirth educators who share your passion for impacting the life of an expectant mother. With LCCE after your name, you are declaring your expertise and commitment to evidence-based practice in childbirth education. The Lamaze Certified Childbirth Educator Certification is the only childbirth educator program that has passed rigorous standards set by the National Commission for Certifying Agencies, which holds one of the highest professional standards of certification. When new and expecting moms are looking for an expert, you will stand apart from your childbirth educator peers when you are Lamaze certified. Lamaze is your ideal partner for current information, support, tools, and education. Lamaze is the only organization with resources specifically for expectant mothers and their families, and resources for you, the childbirth educator. Lamaze is working hand in hand with you to make a difference, one mother at a time. So how can you join thousands of others who are Lamaze certified? Depending on your experience, there's a pathway to LCCE certification for you.
Inspiration to become certified by Lamaze really began with my own journey to becoming a mom, and I wanted to impart the knowledge and support that women need during this process. It takes so much to be successful and to have a good journey, and I wanted to be part of that.
Being a Lamaze certified childbirth educator gives me a really unique perspective in nursing education. So childbirth educators have always worked really, really hard to make sure that we have a way of reaching out to consumers and a way of reaching out and making things evidence-based but also interactive.
Trend.
Come on. She's about to get into the water. What?
It's a birth plan many moms-to-be are turning to, highlighted in the Jennifer Lopez film, The Backup Plan. Women choosing water birth will find a much more sophisticated setup at Brookwood Medical Center. It's the first dedicated water birth suite of its kind in the area.
It's another avenue for them to have some pain relief and to allow their bodies to relax during the birthing process and the laboring process.
Dr. Nate Ross has delivered about a half a dozen babies by water birth.
We have to use these gloves that go up to your arm or go up to your shoulder, you know, when we're checking people normally, you know, rather than a glove that just goes to the wrist. So yeah, it's a little bit different experience. You have to bend over in the tub. And
Dr. Ross says his practice delivers about 75 babies each month. 1 or 2 of those are delivered by water birth.
There's definitely a trend of more and more women who are interested in having different options when it comes to natural and unmedicated delivery.
Dr. Ross says in the past, both labor and delivery were done in the tub.
A baby has a natural reflex that it will not try to breathe in if it's underwater. It's a natural reflex.
But these days, the tubs are used mostly just for labor. The water temperature is regulated for both the mother and the baby, and the warmth can ease labor pains.
Give me a mirror, I want to see it. No, you don't.
There can be concerns about sterilization, but Dr. Ross says they haven't seen that issue at Brookwood. He says it's important to remember water birth is only an option for low-risk births.
If she has some blood pressure problems or is a diabetic or has certain infections, then the water labor and delivery is not a good option for her.
Nevertheless, with the interest in natural lifestyles building, Dr. Ross sees the same trend.
During the birth canal, it'll tear from the wall of the uterus and start bleeding, and so the patient can bleed to death. Treatment for this is to contact medical control, establish an IV, and get the patient evacuated as quickly as possible. If the fetus is under a stressful circumstance, its bowels will let loose. The first stool is called meconium, and it's in the amniotic sac, so the fetus is breathing it in and is covered with this, and that's a sign when you see a green stool-covered baby like this that there was fetal distress, and you can expect that the newborn will also be in distress. So your treatment is maintaining the airway, breathing, and circulation of the fetus, and talk to medical control about what you need to do. Alright, now let's switch to labor. Labor is a 3-stage affair. The first stage occurs with the first true uterine contraction, and women can have false contractions long before they have their first true contraction. But in the true contractions, their body is gearing up to deliver this baby. And it ends when the cervix, which is the bottommost part of the uterus, essentially, that protrudes into the vagina, completely dilates up to about 10 centimeters so the baby can fit through. The second stage starts at that point and ends when the infant is delivered, and then the third stage starts when the infant's delivered and ends when the placenta is delivered. So you have to remember that both the infant and the placenta need to be delivered to complete labor. Now hopefully you'll have a pre-made obstetrics kit available to you in the event of a delivery. It may say emergency childbirth kit or something similar. It's going to be a fairly generic kit, so take a look at the outside. They're usually sealed in plastic and they list their contents. And usually they'll have these items in there which are useful for delivering the baby. What you really need at the end of the day, a pair of gloves for you, preferably a gown because it's a pretty messy affair. And as you deliver the baby, you need the ability to tie the cord close to the fetus, tie it a little bit further away, and something that you can cut between those two ties to free the fetus from the placenta. So if you think that someone is in labor and going to deliver, first thing you need to ask is, are you pregnant? And if they say no, make sure you confirm that. If they say yes, which they probably will, how far along are you? That will tell you how well developed the fetus is going to be. You ask, are there contractions or abdominal or back pain? How often does it happen and how long does it last? The more frequent it is...
Stillbirth. If you become pregnant, your womb doesn't shed its lining as it normally does at the end of the menstrual cycle, so your periods temporarily stop. This is because the egg, which has been released from one of the ovaries, has been fertilized by a sperm, and you are in the early weeks of pregnancy. Here we show the ovaries, the fallopian tubes, the womb and the vagina. The fertilized egg has already started to divide in the fallopian tube. It will continue to develop and grow in the womb and is called an embryo at this stage. Here we show the embryo in the womb. By week 9, the embryo has developed and is called a fetus. At this point, most of the organs, including the nervous system and heart, are forming. Here we show the fetus in the womb. By the time you are 12 weeks pregnant, your baby is approximately 6 centimetres or 2.5 inches long. At this stage, your baby's neck is uncurling and the limbs are complete. The eyelids are still fused and the ears are forming. Here we show the baby, the umbilical cord, the placenta and the amniotic fluid. The umbilical cord connects the baby to the placenta. This is how your baby gets nutrients and how waste, such as urine, is removed. In the second trimester, your baby's sex organs develop and other organs mature. The baby swallows amniotic fluid and passes it out through its digestive system. The kidneys start to work and pass small amounts of urine. Your baby can now hear and is covered in fine hair called lanugo. Here we show the baby in the second trimester.
No te preocupes, empezaré a chillar y todos os despertaréis.
Pero chilla fuerte, ¿eh? Que tenemos el sueño... Somos de sueño duro aquí, ¿eh?
No te preocupes, entraré habitación por habitación. Lo acaban de ver, es una contracción. Hay que respirar.
Explícalo porque como yo no estoy puesto en el tema, no sé...
Y no concentrarse en el dolor. Pero si se concentra uno en el dolor, mal.
Concéntrate en la luz, Susana.
Hay que respirar.
En la luz de la lámpara. Bueno, a ver, que nos explique un poquito cómo lo ves.
Muy bien, largo.
Lo ves largo,
seguro.
pero bien.
Largo, pero seguro.
Largo, pero seguro. Oye, pues eso es importante, ¿eh?
Después de una noche tan larga, yo estoy agotada, de verdad. Me he levantado, parece que me han traído a un funeral. Vamos a ver a la mamá que está ahí. Empezaron las contracciones a las 6 de la mañana. Y son las 7:54 de la mañana y ahora van a hacer Dani enseguida.
Un poquito más. Yo te aguanto, cariño, yo te aguanto. Pero, muy bien. Abajo. Qué cariño. Has dicho tú te...
Bueno, vamos a esperar nada más que estén todo controlado, ¿no? El aceite, que luego a última hora nos hacemos. El agua ya está aquí.
¿Está ahí?
Vale.
Porque podría estar esto aquí que vas a poner material. O lo pones en el...
En una silla, si no es demasiado abajo. Yo me busco. Mira qué máquina tienes ahí. ¿Escuchas? Ahora has de pensar en tu nene, Dale bien oxígeno porque son los momentos en que más necesitará, ¿vale? Le vas a apretar mucho la placenta. ¿De acuerdo? Venga, hombre, si ya lo tienes ahí. Y 3, va, tírate, va. Venga, más fuerte, Leslie. Venga, Susan, va, vamos. Va. Vamos, más. Muy bien, guapa. 1, 2, 3, fuerte, ya, vamos. Venga, ahora se está peleando con los isquiones. Va, venga. Venga, esas rodillas hacia ti, bien abiertas. Tienes que abrir isquiones, va. Muy bien.
Muy bien.
Bien, cariño, bien.
Respira, tranquila.
Tengo todavía.
Todavía tienes, venga. 1, 2, 3, abajo. Va, Leslie, venga. Venga. No tengas miedo por eso, va. Venga, empuja.
Eso.
Muy bien. Dale oxígeno al Dani.
Tranquila, mamá.
Escucha. No.
Es que me duele.
No empujes. Dale, escúchalo.
Perdón, mamá.
Me das agua, Cris.
Susan, respira tranquila, guapa.
Va.
Muy bien. Bravo, chico.
Un 10 para Susan.
Y para Dani.
Y para Dani.
Para Dani.
Y para todos los presentes.
Eso, también. No, espera,
No me lo pones celosa.
¿Qué?
No sacas eso,
Venga, guapa.
Venga, cogemos
Va.
fuerza y abajo.
Venga, va. Vamos. Venga, que lo tienes aquí, leches. Vamos.
Venga, mamá, tú puedes.
Cambia el aire. Fuerte abajo. Venga, sigue. Estírate bien de las rodillas. Vamos. Muy bien. Ahora se ve un poquito más.
¿Dónde yo? Sí.
Va.
Me has pisado.
Todavía podías subir un poco más.
De otra manera me has pisado.
Estás bien, vale. Venga, vamos. Empuja al culo. Vamos. Eso es. Venga. Vamos. Venga. Vamos, fuerte, más. Eso es. 1, 2, 3, empujón fuerte. Ahora vamos. Va las dos, vamos. Venga, 1, 2, 3, fuerte. Va, todavía hay contracción. Vamos. Más fuerte. Eso es. Vale. Ya está, correcto. Muy bien. Quita la cara. Vamos, sigue. Sigue. Venga, muy bien. Vamos, 1, 2, 3, vamos.
Venga, mamá. Mira ahí la cabecita. Tiene como aplastar.
Genial,
Tía, ya lo tienes.
Vale, ahora.
Otra vez, por favor.
Venga, no, aguanta un poco. No tienes contracción, respírale, Susan.
Tócate la cabeza.
No quiero.
Escucha,
Respírale.
Ahora está entre...
Sí, se escucha en un momento,
Parece que la cabeza aplastada.
No, para respirar, Tú tranquila. Dile que tranquila, a él también. Que le falta un... Gíramelo.
Espera.
Ya está. No, boca abajo.
Boca abajo. Sí. Ya está. Vamos a ver.
Hola.
Ana, pon la boca abajo.
Boca abajo.
Ponla abajo. Boca abajo, mirando a Rosa. Ya está.
A ver, mira la hora.
Ya está.
¿Qué hora tienes?
Son las 9:33.
Vale.
Pone también la
No,
cámara.
las 9. Las 9:33. No, mi amor.
Pues a la radio 32.
Enhorabuena.
A ver, con esto
Te he duchado un poco, ¿eh?
me he duchado un poco.
Es tu hermanito, cariño. ¿Eh?
Oye, ahora esto de cortar el cordón umbilical. Es verdadero. Me estoy cayendo de la cama.
No
te preocupes, estamos aguantando. Es un nudo de verdad.
En el cordón. Es súper raro ver eso.
Joder.
Mira, mi amor. No vio Bicamay, ¿no?
No.
Mira, papi.
Qué color más bonito.
Sácale este nudo, mira. Tío. Sácale
Mira,
esto.
mi amor. Que se ve súper pocas veces.
El niño, ¿por qué? Está,
Pues después de cada 100 y pico de partos sale así.
está
mira, mi
vivito
amor.
porque Dios quiere.
Ya se
Mira.
acabó.
¿Por qué ha querido? ¿Por qué ha querido?
Porque la vida...
Tiene, tiene que ver mucho el nacimiento de ella con el suyo. Mi hermana nació con el cuello. Con el cordón al cuello.
Pero
Ha
el
nacido
cordón,
con
pero
vuelta
lleva
y con un nudo.
Es que normalmente con vuelta sí que nacen más niños, pero con nudos es que hay muy pocos. Entonces uno de cada 200 o así. Más o menos.
We're doing the assessment on the baby.
That's so
Another
important.
really wonderful thing that we have gone through is our electronic charting system. And what happens then is it links us, first of all, with our physicians. So whatever Dr. Lown, for instance, sees or puts in this chart in the office comes through to us the minute that the patient comes to see us in triage. And that is a real benefit, not only for us to know it immediately, but it helps to keep our patients safe.
Yeah. And this is a place you're going to find a lot of smiling faces. We're here with new mom, Jamie Hebner, and Chase, almost 2 days old. Jamie, what did you think of your experience here?
The experience was wonderful, actually. They came in and took care of her every couple hours, answered any questions that we had. The food was actually wonderful. They had good omelets, good breakfasts. And the other thing, too, is just the rooms were really nice and large and great for family and friends to come visit. So it was a really good experience.
And she's beautiful.
Thank
Congratulations to you.
Thank you very much.
We are here at the Spartan Stores Family Childbirth Center at Metro Health Hospital. Come and see it. A beautiful place. Wow, wow. I know, that's wonderful. Actually, they're so beautiful, the babies there. The facilities are great. Having gone through the experience not too long ago, a year and a half ago, can really attest that that would be a very comfortable place to be after going through such an amazing thing.
Right.
You know, that's the biggest thing, pretty much, as you know, moms and dads know, grandparents, to have another member of the family join, you know, the world and your family, and so you really want a comfortable place to have those memorable moments, and it is just beautiful what they have.
It is.
At Metro Health Hospital.
It's an extension of what Metro offers across the board, but really that personal, comfortable feel in the most high-tech, safe environment possible. So again, congratulations to new mom and baby doing well. What an adorable little baby.
Yeah, she was gorgeous. I did get to hold the baby.
Fantastic. Did it make you want to have another one?
I went to families about to have a child to come somewhere that they feel really comfortable.
Sure.
What exactly will they see when a family comes here to have a baby?
Absolutely. Well, what they can experience first is what we call the triage area, which is the area where we bring patients to assess whether they're really in labor or not. Once they're determined whether they're in labor, then it's like I said, they get the golden ticket, and then we admit them into the labor and delivery area, which is where we're at right now.
Yeah, and looking around, you've got a lot of wonderful accommodations here. Probably the nicest I've seen.
No, it's just absolutely beautiful. It is.
It is. So you've got your TVs, you've got bright big windows, and this is a large room too.
Yes, and all our rooms are the same. All our labor and delivery rooms are centered on the outside here, so they have a beautiful windows and lighting. And again, nice big flat screen TVs, and we want to make it warm and welcoming for not just the patients but their families.
Yes, because this is one of the most memorable moments of someone's
absolutely.
life. After the child is born, where does the mom go after that?
Well, they're brought over to the labor or to the postpartum area, which is on the same floor, which I think is a big benefit that we have here. Again, we try to make it as warm and inviting for our patients as we can. The postpartum rooms are similar to this, only they're they're slightly smaller, but again, they're all on the outside of the building, and they're all centered around the nursery, so the moms are never far from their babies.
Wonderful. And I know last year you had more than 1,600 births here at Metro Health Hospital, and that's actually, your numbers are going up.
Yeah, they are, which is amazing. We're the only hospital in Grand Rapids area that had an increase in births over this past year, which, again, compared to what the state of Michigan is with an overall decrease in births statewide, I think we're doing very well.
Wonderful to hear. We're here now with one of the RNs at the Childbirth Center, Nyla Caparis, and I know that you really try to make this a very personal experience.
Yeah, that was one of the goals when we moved here. We wanted high tech, but we also wanted mainly high touch, and we have been doing that. And a few things that make evidence of that is we have state-of-the-art